Okay, good afternoon, everybody. Thank you so much for taking the time to be here. As many of you know, I have spent the past 20 years of my life, since my life with cancer began, working with cancer patients who have a tough time accessing the health care they need. I've spent a great deal of time looking at how we might improve that access for every citizen in Jacksonville. Good health is one of the pillars of my campaign for mayor, and frankly, it is the backbone of economic prosperity and quality of life. In a recent survey, Jacksonville residents listed health as the #1 driver of their quality of life, and nothing else came close. Here's the reality in Jacksonville. We have some of the finest medical institutions in the country right here in our city. Yet we are the only major metropolitan area in Florida to rank in the bottom half of health outcomes on multiple fronts. Obesity and diabetes rates are 18% higher than the state average. Premature death, 36% higher. Drug overdose deaths due to addiction, 66% above the state average. And listen to this, our child mortality rate, a whopping 80% higher than the national average. We have many wonderful organizations who try to make a dent in these disturbing numbers, but we've left them without the support they need for maximum impact. The bureaucracy for services is astounding for both patients and providers, and there is an inefficient use of city dollars due to a lack of coordination of those services. Our city does not apply for many federal, state, and private grants, and we have not taken a leadership role in leveraging available programs. I aim to change all of that when I become mayor. When I started to look at how to craft this policy, I went right to the source. Doctors and other health professionals who witness our health access barriers firsthand. I'm grateful to have some of those doctors here with me today. Our Good Health Plan has 4 initiatives which I believe, once implemented, can radically improve health outcomes in our city, decrease disparities in access to health care and inequities in health outcomes, and help us prepare for future emergencies, including pandemics, hurricanes, and climate change. I'm going to highlight each of those, and then I'm going to ask this esteemed group of doctors to come up and tell you more about that plan, because they were really the architects of it. First of all, I will appoint a chief health officer. This will be a physician. That doctor's job will be to make Jacksonville's health a top priority and make sure our city is the best partner for local healthcare entities, both public and private. Will also hold us accountable for how city dollars are spent on healthcare, which right now we really don't do a very good job of. Second, we will provide enhanced support for the nonprofit and philanthropic efforts working toward improving our health. Third, I will create a health-specific communications team to ensure needed education and information gets to the community. This has not been a priority. And finally, I will fight for the city of Jacksonville when it comes to home rule and funding for health, which has been absolutely decimated at the state level. To address each of these initiatives, I'd like to introduce 3 doctors who are no doubt familiar to many of you and who have been working to improve health outcomes in our city for a very long time. They have been instrumental in crafting this policy. I'm going to introduce each of them, and then I'm going to have them come up and speak with you. First of all, Dr. Cain. Dr. Cain is the president of the Northeast Florida Medical Society Foundation and has been practicing as a family physician in the North Side for 30 years. During his entire career, he has provided leadership in the community to improve access to care and to reduce health disparities in the city of Jacksonville and in the state of Florida. Dr. Jeffrey Goldhagen. Dr. Goldhagen is a professor of pediatrics at the University of Florida. He has served in Jacksonville and has served as the director of the Duval County Health Department for almost 15 years. He serves as the president of the International Society of Pediatrics and has been heavily involved in advancing the health of the Jacksonville community for 30 years. And last but certainly not least, Dr. Sunil Joshi. Dr. Joshi is an allergist, immunologist who was born and raised in Jacksonville and is passionate about the health of our community. He has most recently been involved in programs to increase flu vaccination rates and to prevent physician burnout. So let's start with Dr. Goldhagen, and then I'll let each doctor come up and talk with you, and then you can ask me any questions you like or them, okay? Thank you. You can move the box.
I want to think out of the box.
There you go.
Well, Donna, thank you for the opportunity to be here, and thanks to the media for covering this. I can tell you with assurance that after 30 years of being here, Donna is the first mayoral candidate and will be the first mayor to establish health as a critical priority for our community. And for that, we owe Donna a great deal of gratitude. And not only has she taken this position, but she has come to us, has come to the physicians in the community who know really from a first-hand basis what the issues actually are and how we need to address them. There has never been, in my 30 years here, in my almost 45 years in medicine, has never been a more critical time. Florida had 65,000 deaths from COVID. Duval County had thousands of deaths from COVID. Most of those deaths were unnecessary, and they were the result of poor policies from the leadership of our community here and the leadership in Tallahassee. That's got to end, and with Donna's plan, which again we have been instrumental in helping her put together, that will end. As you may or may not know, the city of Jacksonville, Duval County, has not had a medical director, has not had a director of public health for multiple years. That's because there is no public health left in our community. And one of the things that Donna will do is restore the confidence in our community of public health, of our medical community, and there is nothing more critically important than that in addressing the public health issues and addressing the metrics that Donna has mentioned. I can tell you also that we leave millions and millions and millions of dollars on the table because of a lack of leadership for searching for dollars, federal dollars, competing for federal dollars that we could easily recruit into the community. So as part of her plan and as part of the role of the Chief Health Officer, will certainly be to mobilize the entire community to bring the resources into our community that can address the critical health issues that are so important to our community. So I'm not going to talk much more. I'm going to be brief, which is not usual for me, and allow my two colleagues to speak at this point. But what I can say is that from the perspective of the health and well-being of our community, there has never been a more important time to have a candidate like Donna and to have a mayor like Donna. Really, our health and well-being, our lives depend on it, and thank you, Donna, for that. So let me turn this over now to my friend and colleague, an icon in the city for sure, and a person I depend on for much of the work that we do together. Let me turn this over now to Rogers Cain. Rogers.
Thank you, Jeff and Donna, especially for inviting me here. I am happy to be here to take part in such a historic event in which we're looking at making sure that healthcare is the priority, a priority here in Jacksonville, adequate healthcare. One of the things that I tend to see being in my 30 plus years, most of it practicing on the north side of Jacksonville, is the health inequities that have been on display in Jacksonville for as long as I've been in Jacksonville. And COVID-19 actually unveiled and pulled back the covers on those health inequities. If you go to zip codes, well, you go to Health Zone 1, priority in which that would be zip code 2, 4, 6, 8, 9, and 54. And then as well as the surrounding communities in terms of 32218, you can see a lot of those communities and neighborhoods do not have things as simple as sidewalks, as simple as having access to adequate food, creating food deserts in a large portion of that community, things that are needed to help individuals have a healthy lifestyle in order, as in exercising, because many of them really don't have access to a park. Many of them don't have access to transportation. And part of what we looked at in terms of creating Donna's platform is how do we help create a healthy neighborhood, and those are some of the things that we must do as a start. Our current, past administrations, while I can appreciate their looking at turning Jacksonville into a more economically city as it relates to downtown development and places of that nature, we still need to highlight development in some of these neighborhoods and provide the means by which they can obtain health equity. The adequate funding that Jeff referred to, actually I haven't seen much of any, at least in terms of the organizations that are on the ground, the boots on the ground, working in these neighborhoods, especially as now FQHCs, as one of the mechanisms by which we can, as partners, the local health department, by creating a health czar, so to speak, for the city of Jacksonville. And so if we can help in any form or fashion, thanks to Donna's leadership and her direction in which she wants to take this city as being a healthier city with healthier neighborhoods. That's what we would like to do, put more boots on the ground, create more philanthropic and local institutions that can work with the people in the individual neighborhoods. Jeff and Donna have pretty much stole most of the thunder that I had, so I had to work around that because they did a very good job elaborating on what this whole plan is all about. And it was a pleasure working with Jeff and Dr. Sunil and many of the other physicians that we came together to formulate this plan. So without further ado, Dr. Sunil Joshi.
Thank you, Dr. Cain. Thank you, Jeff, and thank you, Donna. And Jeff mentioned earlier that I was born and raised here in Jacksonville, by the way, and I never have had anyone run for office here locally or for a state office ask local doctors what we thought about the health of our community and ways in which we can improve it until Donna came to us. So when she came to us asking for advice on ways in which we can have an all-inclusive plan, I said one of the key points for this is going to be communication. In order for us to get to each part of Jacksonville, you're going to have to be able to communicate to different corners of our community. In a city as large as ours, in size, area-wise, population as well, and with our unique diversity, race, ethnicity, socioeconomic backgrounds, you really do have to have a concerted effort in order to get the message across to every little corner of Jacksonville, Florida. So messaging becomes the key. There are parts of our community that get their medical information from their doctors or healthcare providers. But there's also a much larger segment of our society that learns about health through what they get from you guys in the media or through social media, radio, television, newspapers. There's another group of people who really don't pay attention to the medical community at all or to media in general. And they get their healthcare information from their friends, their family, their coworkers, or people in their places of worship like their churches, synagogues, or temples. Part of the challenge in a city of our size is to get the word out to all of these different groups of people. If we've learned anything through the last year, it's that going to where people get information is probably the key thing. And we learned a few things here recently with our citywide initiative on flu vaccinations that went incredibly well and successful. It was successful because we collaborated with different groups of people, not just the traditional medical healthcare messengers. So part of what Donna's team will plan to do in the future is to coordinate outreach and messaging efforts with parts of our community so that we can effectively reach larger numbers of the population. This will include coordinating messages with local not-for-profit organizations whose missions are already tied directly to improving the health of our citizens. The Jacksonville business community, who can get the message out to their employees, and we have a few Fortune 500 companies in town. Public schools, private schools, so we're getting messages out to children, but also to their parents. the local colleges and universities where we have young adults who also are impacted negatively by certain health-related issues in our community. The local hospital systems who work really well together to come together for efforts to help the health of our region. The traditional media, social media, but we cannot forget going into the communities that typically don't trust healthcare workers or medicine in general. So that'll include going into churches and synagogues and religious organizations to get the word out to their membership from people that they trust in that regard. The whole idea is to get the word out about health-related initiatives here in the city of Jacksonville, but more importantly, health-related emergencies that can come up. The recent pandemic, of course, is a great example of lack of coordination in terms of testing, vaccinations, and treatment strategies. Not just here locally, but throughout the country. That was a major, major concern. But keep in mind, we have other health-related issues here in Northeast Florida that are associated with natural events. Hurricanes, hurricane preparedness, making sure people's health is also managed during times of disasters. Nor'easters come through our community on an almost monthly basis and can lead to flooding in certain parts of our community, and that in itself has health-related issues. The red tide that tends to be an issue in the summer with the Gulf Stream also does affect Northeast Florida and affects chronic respiratory conditions in this region. Poor air quality due to forest fires that may not even be in our county can also affect our population's health. Mosquito-borne illnesses during summer rains are another issue that we deal with on a regular basis. So getting the word out, communicating to people about these potential healthcare-related issues is critically important. Communication also becomes key when we talk about preventing illnesses here in Jacksonville. Certain negative health-related outcomes, such as sexually transmitted diseases, teenage pregnancies, infant mortality, premature cardiac death, diabetes, and of course violent crime here in Northeast Florida. So having the appropriate messaging to get into these communities gives us a chance to be successful as we go forward. So these are just some of the things that Donna has in her healthcare plan, and we're here to answer questions and here to help in any way we can. Thank you.
Thank you, Sunil. Put my box back for a second. Thanks to these amazing doctors and to so many more. We had a very large group and then we will continue with this policy group to continue to develop policies that are good for Jacksonville. That's the idea. We want to get to those issues that are holding us back and make sure that those issues, those barriers are removed for people. If you're not healthy, it's hard to be a productive member of the community. It's hard to be a productive member of the economy. That's why it's so very important, aside from the fact that it's just the right thing to do. That's what people need, and that's what they're telling us as we go around Jacksonville talking to members of our community. So obviously, from where I come from, as a cancer survivor who has founded an organization that focuses very heavily on helping those folks who are going through a difficult time, this has been a focus for me for a long time. So this is not something new. I've been talking to doctors and other folks for a long time, but this group particularly was amazingly helpful. I just want to say one thing about the final point, and that is about the local rule issue. That's the final part of that plan, the initiative to make sure that we are pushing back on state efforts to eliminate our local control. You heard Jeff talk some about that, but it's very important. We used to spend tens of thousands of dollars more on our local health care than we do now, and we really have to get back to where we're investing in our community, and we can do that by simply being more accountable for how we spend our dollars and making sure that we actually make going after these federal dollars and other private dollars a priority. I said when I kicked off this campaign, there's nothing that's ailing Jacksonville that political will can't fix. And if we have the political will to make our community healthier, we can do it. So with that, I'll answer questions, or you're certainly welcome to ask the doctors any questions.
I have a question maybe for all the doctors, or specifically Dr. Goldhagen.
Okay.
You guys say pushing against state efforts. I had a question for you specifically about the Florida Surgeon General recommending against COVID vaccines for kids.
You want to step up, Jeff?
Sure. I've actually already given a couple of presentations on this to the media. I don't think there's a more grievous assault on children that I've experienced in my 40-plus years in medicine. What we saw yesterday was, quite frankly, a group of people that came together. It was like a puppet theater, and the individuals we saw there were puppets for Governor DeSantis and Dr. Ladapo. We know that vaccines work. We know that they're safe. We know that kids can get sick. We know that tens of thousands have been hospitalized across the country. We've had hundreds hospitalized here. We've had deaths here. Kids die from COVID. We don't know the long-term effects of COVID, and clearly that's a critical issue. We need to do everything possible, and vaccinations are the most critical tool that we have to stop the spread of COVID in our community. And I can say, and I'll speak perhaps for Donna, that this would not happen in an administration under Donna Deegan. We would be coordinated in our response. Families need to trust their doctors. They need to trust the American Academy of Pediatrics. We have been here focused specifically on the best interests of children in the past. We're here now. We'll be here in the future. Under an administration of Donna Deegan, we'll have far more capacity to do what we need to do, and frankly, what we know how to do.
Jeff, can I add a little something to that, please? One thing, I know we're discussing pediatrics, but these kids live in many neighborhoods, multi-generational household, those most vulnerable to COVID, okay? And even though they may be vaccinated, as Jeff said, the elderly and those, particularly in these underserved areas, there may be 3-4 generations in a household. So it's not just the kids that will be affected when they're not vaccinated. They take it home to the parents, the grandparents, you know, the great-grandparents that live in that same household. So we're actually creating a even greater hazard than just with pediatrics.
Any other questions, guys? Anybody have any other questions? Thank you so much for being here. I appreciate you so much. Thank you. And thank you to these wonderful doctors. Appreciate that.